We're being joined now by clinical neuropsychologist Kristen Dams-O'Conner, who directs the Brain Injury Research Center at Mount Sinai here in New York City. Doctor, we know CTE can be only diagnosed posthumously, but what are the symptoms that you would see during a person's life?
Some individuals who have been diagnosed with CTE after death have been found to share some clinical symptoms in common, including cognitive impairment, progressive neurobehavioral impairment, and other signs.
And yet it appears that this perpetrator had some insight into his condition. He wrote himself, "Study my brain," before shooting himself in the chest. Is it unusual for patients who might have CTE to have that awareness of their condition?
It's highly concerning when a person who's experiencing mental health challenges believes that those symptoms are solely attributable to a neuropathological disease that cannot be diagnosed during life.
And yet the neuropathology reports, those experts who wrote the assessment of the perpetrator, said that he had low-stage CTE. What is the difference between high-stage and low-stage CTE?
The difference really comes down to how many of these pathological lesions are seen in the brain and how widely distributed they are across the brain.
And so what kinds of treatments are available to patients who may be aware of some progressive brain disease like CTE?
Right now, we cannot diagnose CTE during life. And right now, there are no curative or disease-modifying treatments for CTE. Research is rapidly evolving towards meeting that goal. Until then, we highly recommend that individuals who are experiencing mental health challenges seek treatment in evidence-based treatment programs.
And yet if there is brain injury, regardless, there are some treatments that are available for people who are suffering early stage dementia, for example. We also know the perpetrator played football in high school, and we're learning that even low-level concussions, low-impact concussions, can have an impact, as well as other contact sports. How do we keep them safer from serious and repetitive head injuries? And what still needs to be done?
Look, there's no amount of exposure to head trauma that can be considered safe. Every effort should be made to improve the safety of contact sports, especially for children, and to eliminate or substantially reduce exposure to head trauma across contact sports.
And so what, if anything, is being done to try to reduce that risk of potential repetitive brain injury?
A lot of contact sports are eliminating head contact during practice. That is a major step. Rule changes can also improve the safety of sport, even at the competitive levels.
And so we know that mental illness is distinct and different from CTE, which is a degenerative brain disease.
It is different. There are overlaps, and this is what makes it so challenging to disentangle what is attributable to this brain pathology and what is a treatable mental health condition. And because of that, the most prudent action for anyone who's experiencing symptoms like this is to seek treatment.
And there are high-profile examples of people who posthumously are diagnosed with CTE, whether it's Aaron Hernandez or others, that they tend to become angry or violent. Is that often the case with people with CTE?
We do see many reports of anger, aggression, hostility, impulsiveness in individuals who have been found to have CTE.
Dr. Dams-O'Conner, thank you for your insights and for your time. We appreciate it. Thank you.
Thank you.